Thank you, Deputy President. Deputy President, I welcome the opportunity to speak about a topic close to my heart, and that is aged care. As you know, in my previous life, I was a doctor working in a major public hospital, and I wore two hats. One was as a general physician, and the other was as an infectious diseases specialist. And as a general physician, which was actually the bulk of my work, I looked after a lot of elderly Australians. It was, in fact, probably the majority of my workload and my case mix. And I saw every ailment under the sun, every problem under the sun. And the characteristic for those elderly, frail elderly Australians who would come through the door and were admitted into hospital was one of multi-morbidity. They would have multiple comorbidities, one on top of another. But there was much, much worse than that. In some cases, these were elderly Australians who were coping or barely coping with social isolation. Some had been abandoned by their families. They were alienated from their families or estranged from them. And others were actually victims of a pretty silent, I think, scourge in our community, and that is elder abuse, where an older Australian is exploited usually by one of their children. And this was a common occurrence, and we would often have to bring in our hospital lawyers in order to deal with this. But there was certainly a surge during the pandemic years, and Senator Colbeck cited 2019 to 2022 and all the achievements of the former Morrison government. But that period for me was spent on the front line in hospital in PPE, caring for a whole string of elderly Australians who were flooding through the doors. Many were gasping for air. Others were delirious. Some had falls, some all three of those things together. And what I noticed during that time was the complete collapse of the aged care system, such that we had hospitals that were getting overwhelmed with frail elderly, and we had a workforce that was utterly decimated during that period, burnt out, and had left the sector. And so is it any wonder that we are now trying to clean up the mess, a legacy that was born from underinvestment, chronic underinvestment in aged care previously over the decade of Liberal stewardship, and then made worse by the pressure test that was COVID. And so, in fact, the first piece of legislation that we passed as a government in 22 was actually not climate change. That was the second one. It was on aged care, and we had to bring in this emergency legislation in order to rescue the sector. And what that has done, what we've seen is, in fact, an uplift, a huge uplift in workforce. We've poured $18 billion into the aged care workforce, and it always starts with the workforce. In care, it always starts with the workforce. The workforce are everything. They are the ones who provide the care. It is called aged care for a reason. It's not infrastructure and all of that. It is the workforce. And so we brought in $18 billion and basically increased the wages of this important mission-critical workforce, such that registered nurses are now $430 a week better off. Carers are $320 per week better off. But that wasn't all. We also brought in 24/7 nursing, and that's present now in 99% of sites. And what that means, having a nurse on site actually means that you get far less egress of patients into hospital, because nurses on site can manage medical issues. They can seek advice, they can dispense medication, they can also palliate patients in residential aged care facilities. And what this has done is, in effect, lifted the confidence of Australians back again in residential aged care. Now, the next piece of reform that is going to start on the 1st of November is a whole new generational change, looking at how we better support Australians at home, how we put their wishes at the and preferences at the centre of everything we do. And that is something that was missing in this Act, the previous Aged Care Act. So there'll be a whole new Act that kicks off on the 1st of November, and that has been passed thanks to the bipartisan approach we have taken with the Coalition. And that Act, a key part of that Act, is Support at Home. So Support at Home will come with the injection of 83,000 new packages into the system, and that is designed to enable more Australians to have autonomy and remain at home, which is entirely aligned with their own wishes.